Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Before we get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that everyone is in listen-only mode. Everyone has music from here, our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. All right, so next I would like to introduce you all today. Joining us, we have Nicole Simon. Nicole is a behavior analyst with over 25 years of experience using the applied behavior analysis framework to care for children and adults with autism spectrum disorder, related disorders, co-occurring mental health conditions, and severe challenging behaviors in home, school, residential, hospital, and community settings. She joins us today to give a talk on safety at home and in the community for individuals with autism spectrum disorder. So please join me in welcoming Nicole.
Thank you so much, Amy. And I just want to make sure my slides are visible. Do I need to share again?
I don't see it yet. If you don't mind resharing it again.
Okay, no problem. How's that?
Looks good.
Excellent. All right. Welcome, everyone. Thank you for joining today during lunchtime. Today, I'm going to be talking about safety at home and in the community for individuals with autism. As Amy mentioned, I am the Senior Behavioral Consultant at the Lurie Center, and we are affiliated with MGH, a satellite program out in Lexington, Massachusetts. For those of you who are not familiar with us, we're a multidisciplinary outpatient clinic serving children and adults with autism and other developmental disabilities. And what makes us unique is we serve both children and adults. So across the lifespan, a lot of other providers out there stop at children's services. And so we follow individuals through adulthood. And as you see, we have a number of disciplines and we work cohesively and collaboratively, which I think is best for patient care. So we have over 3,000 patients along with a robust research program. But today our focus is going to be on talking about unsafe behavior for children and adults with autism as it relates specifically to safety concerns at home, in the car, and in the community. And at the end, I'll share some additional resources. As Amy mentioned, this will be recorded. There's going to be a lot of information that I'm about to give you, a lot of great resources, and we'll also tag in a link to some additional resources at the end. So just know that if you're furiously taking notes, you can always go back and rewatch or get the information from a handout at the end. So what is unsafe behavior? What we're talking about today is any event or series of events or behaviors which can cause an individual any harm to themselves or harm to others. And other people might be other family members, parents, siblings, certainly anybody coming into the home or anyone that individual contacts out in the community. These are some most of the most common home safety concerns that I come across and probably encompasses what you might be seeing at home. So certainly challenging behavior, which comes in many different forms. This could be physical aggression, hitting or hurting others. It could be certainly self-injurious behavior, that individual hitting or hurting themselves. and then a whole host of other things that fit into that category. And so certainly keeping the child and family members safe, especially the siblings, is a priority. Property damage, so damaging items within your home. That could be windows, that could be vases, TVs, you name it. Elopement. This is just a fancy word for leaving without permission, running away. And we're going to talk about that as it relates to water safety as well. Food management or food stealing, behaviors that occur when family members are sleeping, and certainly, challenges with neighbors where you might have neighbors who are wonderfully helpful and in support of some of the difficulties that your child or you might be facing. And then you might have neighbors that are challenging and are not so supportive of tantrum behavior or screaming or, a child running into their homes in the middle of the day. There might be others that you are experiencing at home, but I like to focus on the ones that I sort of most commonly hear about. And I also like to mention too, as many of you are parents and caregivers, that 56% of individuals with autism exhibit aggressive behavior toward caregivers. So a pretty high percentage there. My talk and most of my work focuses on being proactive. And so we're always thinking about safety first. Is your child safe? Are your other children safe? Are you safe, right? That's a number one question you want to be asking yourself. If the answer is no, I'm guessing that's maybe why you're here today, then we need to think about what are some strategies we need to put in place and how do we do that proactively. So I'm sort of giving you the outline here, and then I'm going to go through each one of these. You're going to want to consider what you need to do environmentally within your home or in your car. You are going to want to think about potentially creating a home behavior plan with assistance, creating a home emergency plan, thinking about if medication might be needed, and then certainly taking data to advocate for increased supports. So here are some sample environmental modifications for the home, okay? If you have a child, and when I say child, I'm referring to a young child or an adult child, but if you have somebody living in your home who leaves without permission, this is where you want to be thinking about getting door locks that the individual's not able to open, right? And as a child gets older, it might be more complicated to figure out what that lock might look like. We want to be thinking potentially about alarms, and you can get you can get certainly fancy, expensive alarms in your home. You could also get little door alarms, and actually, if you see in the sort of middle right, that's an example of a window alarm. All that means is when the window goes up, the alarm sounds, okay? So it's something that you could put on a bedroom window, for example. You could put that same type of model on a bedroom door. So that way the door opens, child leaves, you're alerted to that. So those are things to consider. Window modifications, if you have a child who might jump out the window, you might put a modification so it can only open, let's say, 6 inches, something that from a fire safety perspective is okay, but is not going to allow them to climb out onto the roof or jump out onto the ground. Refrigerator cabinet locks, that's this other picture here in the middle. And there's, again, all different kinds of these. In the handout, you'll see links, but honestly, you can sort of Google, look at Home Depot, look at Lowe's, you'll see lots of different examples. Making sure that knives and other unsafe items are out of reach. If you have a child who has a tendency to pick up things that break and throw them, you probably want to limit having those out in your house. If you have a child who likes to throw things at the TV, for example, you probably want to think about maybe putting some sort of protector in front of the TV, right? So there's all different types of things that we want to be looking at here. A quiet area and space I'll talk about in a moment. Name IDs, name ID bracelet, shoe tags. These are all good identifiers, along with tracking devices. And I'm going to give some example of those. Down at the bottom here, you see a picture of the big red safety box. This is free. Again, it's something that you can Google and order, but it gives all different tools and little, stickers and just resources that can be helpful for dealing with safety. The quiet area or space in the home, this is a common recommendation that I have. If you, again, have a child who may, become frustrated, overwhelmed, potentially aggressive, even just overstimulated, having a dedicated space in the house for them to go, not as a timeout or because they're in trouble, but just as a place that they associate with as this is a positive place that's relaxing, that's calming, that's my space that I can go to. And this could be in their bedroom, again, depending on the setup of where you live. The bedroom might be the best place. If they share a bedroom, that still might work. Or you might have a quiet area in a common space, maybe in a basement area or in a living room. But again, it's a positive place to go for relaxing or calming, and we introduce it during calm states. We want to practice that calming routine. Maybe there's a beanbag, maybe there's music, maybe there's fidget toys, noise canceling headphones, a weighted blanket, but we want to tailor it to our child to make it a place that they want to be. That way, once they have that positive association, in a moment where they're starting to, maybe show those first signs that they're having difficulty, that could be a place they could go to, and maybe you remind them of that. But I highly recommend for your child have a designated space in a quiet area that is tailored to them, where they can practice that relaxation, chilling out in a positive manner when they're doing well, and then access it when they are having difficulty. I mentioned tracking devices. There are a number of tracking devices. This would be for a child or an adult who elopes, who leaves without permission, right? That's extremely scary, and it's something that we take very seriously. If you have a child who does this, and you have a whole host of examples right there, I would encourage you to look into these GPS devices. Some of you may have children who have sensory sensitivities. If you put something on their wrist, they would take it off, for example. There are different materials, and there are different devices that are not removable, if that's something that would be more helpful. Some people don't want to get into the actual official kind of tracking devices. Some of these, by the way, can connect directly to the local police department. So, there's a link there, and then the police can be involved if you've lost your child. But others, things like a smartwatch or even a phone, if your child is old enough to wear one of those, and they're unlikely to take it off or to sort of toss it before they're going out the door, that is sometimes a preference that parents have, because as you probably know, things like smartwatches, phones, they have tracking devices built in, and you can link it up to your phone and identify where your child is. But again, it just completely depends on the age of your child. Are they willing to keep any of these items on, or do we need to think about something that's going to be with them that they're not able to take off? The Apple AirTags, that's something that you could potentially put on their shoe, for example. But once again, they're likely to kick their shoe off. That's not going to be a great resource. So lots of different options. I'd encourage you to look into these because it will give you peace of mind in the event that your child leaves without your permission, that you will be able to track them down, locate them, and keep them safe. Another resource I actually just recently added to this presentation, because I learned about it when I was at a conference, and a parent actually who has an adult child was talking about this being the only kind of lock that works for them, right? When you think about trying to put locks on the inside of your house, certainly one of the worries is around fire safety, right? You don't want to be in a situation where you've locked yourself into the house, you've deadbolted it, the child can't get out, but by the way, there's a fire safety issue and you don't know where the key is. So these analog code locks can be really helpful. It's a code that You make sure that everybody in the family knows, except for the individual who might be trying to leave. And you can see this shows the front and the back. It's on the inside of the door, and then of course the door still has a lock that can be used on the outside as well. So again, just examples, and these will be in the handouts to think about what you can do if you have somebody who has a tendency of eloping. Eloping related to water safety, this is also extremely important. Autistic children and adults who cannot swim, who live near a body of water, and who tend to wander without permission are at a higher risk of drowning. This is also extremely serious. It's something that we bring up and we talk to families about, because you might not be thinking about it, but just as a general rule, never too early to start swim lessons, and even to just expose your child to water. Also, never too early to start thinking about how do we teach water safety rules, right? Basic things about temperature, and risks around water being too hot, things around maybe water being shallow and not wanting to jump into water that's too shallow. So we can do that quite early on, start exposing our children to that. And certainly if you're a pool owner or your neighbors are, you want to take the precautions of locking the gate around your pool, reminding your neighbors to do the same thing. But the statistics are really scary. And it's why we want to be very, very proactive in regards to, if we have a child, again, who has those risk factors, what we can do proactively, environmentally, to ensure that they're not putting themselves at risk near water, and then also making sure we're equipping them with tools like swimming lessons and water safety lessons to help them in the event that they are encountering water without adult supervision. Creating a home behavior plan. This talk is not going to focus on this so much. As you see at the end of the slide here, we offer another course called Behavior Basics that gets into how do you create a behavior plan for the home setting. So I'd encourage you to take a look at that. But really, you would want to seek professional help. Typically, a board certified behavior analyst, that would be somebody like me, would be able to help do an evaluation at home and create a home behavior plan that hopefully is going to be parent friendly, in the sense that you can then carry that out when your in-home supports are not present. In the event that you do not have in-home ABA or in-home supports, ABA is applied behavior analysis, you might consider if the school program or the day program that your child is in, if they're in that type of a program, can they offer home supports, or can they offer recommendations? They might have developed a plan or have resources that they're able to share. They might say, oh, this schedule works really well. This visual works really well with your child. They tend to do 3 work activities and then they earn a break, or they earn, time with a special toy or with their iPad. These are things that have already been created. If they're working well in one setting, you might consider, could I carry that over to the home setting? Certainly seeking out those in-home ABA services might be helpful. I will caution you that wait lists can be long, and we recommend that if you're interested in in-home ABA, to get on many of those wait lists, because it can be a year or longer. So start early. The quality varies. Some of these in-home programs are excellent. Some of them are questionable. I would say, generally speaking, that it comes down to that clinician and those direct care staff who are into your home, who come into your home, as far as generally what that quality is, and folks who have more experience in the supervisory level and provide good supervision to the folks working directly with you and your child, that can make a really big difference. And certainly you want to check your insurance to make sure that these services are covered. As I mentioned, we offer the course at the Lurie Center, which can be quite helpful as well. Creating a home emergency plan. So this is something that we would recommend you're able to sort of think about what's relevant to your child, and then think about what information you could put on a piece of paper and post for really anybody's use, even your own. Okay, so in a really stressful situation, you might know all the information, but you're sort of like, you don't want to be looking for phone numbers, right, in the middle of a crisis. You want to be able to grab a piece of paper and know, okay, here's where all the information and who I need to call. So notifying neighbors about your child. This is a personal decision. This is something that some parents are private, and sort of, this is our family and it's nobody else's business. And others of you may want to think about a neighbor could be really helpful, or a certain neighbor, right? Maybe not all of your neighbors, but they could be helpful. We'll let them know about our child and some of the challenges, if it's tantrums or if it's, bolting or eloping. I would say that for those who, if you have a child who does have a tendency to elope or to run away, listing the favorite places they like to go can be really helpful. Letting the neighbors know, right? This is when they're going, they're looking for the convenience store. They're going to, trying to go to that pool or look for this dog in this neighbor's house, whatever it is, put that down. So that way that can be helpful in the event that you need help in looking for your child. What do you do with the siblings when a crisis occurs, right? Now, this is going to completely depend on age. You have a very young child, toddler, right? They generally need to stay with you, or they need to be in a place where they're going to be safe, in a crib, in a place that's closed off. You have an older child. We have to start thinking about what their reaction and response is going to be to a challenging behavior, or to repeated challenging behaviors and meltdowns, right? We want to think about, can we separate them from being exposed to watching this and listening to it over and over and over? And what does that look like? Do they get do they put on headphones and go to their bedroom? What are the conversations then we're having with them after? Because we're often thinking about how we deal with that safety situation in the moment, but we're not necessarily thinking about how does that impact other people in the home. And certainly from a safety standpoint, we want to keep siblings separated, in the event that the child who's having a hard time is then going to potentially go after one of their siblings. Do we need to consider calling a local crisis team? So this is what I was saying earlier, where you want to make sure you have those numbers ready. Have that contact information available, not the time during the middle of the crisis to look up what is the number to my local crisis team. Have that number available. This is going to be different than 911. This isn't somebody who's going to be coming in instantly. This would be, a crisis team might have a conversation with you. They then might come in a little bit later that day to do an evaluation, to make a recommendation, what needs to happen here. This is not, this is different from 911, which is we're in an emergency situation that is unmanageable, it is unsafe, and we need help to come in right away. That's when you would be considering calling 911. If you have a child that you think you might need to call 911, either because of an incident that you're not able to manage at home, or because there's a possibility that they might run away and you're not able to locate them and you need the help of the police, we recommend that you alert your local police department about your child. They have forms that you can fill out. That you can give your child's name and age and description, of the baby, that your child's autistic, and they engage in biting behavior, and they also might run away. This is where they tend to go, right? You can bring them to the local police department, introduce them, and fill out this information. There's also this newer program, I believe, called Smart 911. This allows specific phone numbers to be registered with specific information like diagnosis, medication, etc. So you can look at smart911.com and see if you're interested in putting in information about your child. That way, if you called on that particular phone, that information is going to come up when the dispatcher takes the call. And then certainly creating that emergency contact list. Who are the people that could be most helpful, and posting that somewhere visible on the fridge, on a bulletin board, somewhere where people can see it. This is something that, again, can be quite useful in the case of an emergency. I just want to speak for a moment about emergency department visits. In the event that you either do call 911 and your child is then going to go to the local emergency room, which, by the way, is not necessarily going to be the case. Just because you call 911 doesn't mean that it's going to end in a trip to the emergency room. It could just mean that officers come in and help de-escalate that situation and then go on their way. But in the event that either you've called 911 and the plan is to go to a hospital, or you decide to bring your child to the emergency room, you want to be specific when you're calling about the current situation and autism. State that very early on, state the age of your child, and just be very clear about who your child is and what the current situation is. That will help them to prepare when you get there. If you can call ahead to let them know you're coming and to request that your child is seen quickly, this doesn't always work. I'll just be totally honest with you. This is why sometimes parents do not want to go to the ER, because they do not want to wait for hours and hours when the situation's already difficult. But maybe you forewarn the folks at the ED that if your child is not seen immediately, there's going to be a lot of challenges. I've seen situations where tens of thousands of dollars worth of damage occur in exam rooms, and warn about that if that's a possibility. So, you just want to do what you can to advocate for your child. If your child or adult is larger, stronger, and you need more people to support that visit and you're able to bring them, that's certainly recommended. When you get there, you want to communicate any behavioral concerns with admissions. Always bring favorite activities, snacks, all those sorts of things, anticipating that the wait might be long and that, again, your child might already be unhappy going there. So bringing anything to make that wait a little bit easier. And then again, stress this enough, but being vocal about the needs of your child with everyone you interact with. You're your best child advocate. You might tell them to move slowly. You might say, he does best if you show him what you're going to do before you do it. If you model on me as the parent, let them touch the, don't assume that every doctor and nurse is going to be child friendly and is going to understand the specific needs of your child. So please advocate for your child, and don't be afraid to do that. You won't be offending anybody. And if you are offending them, that's okay, because this is information that they need to hear. I want to bring your attention to something that you may or may not be aware of. At MGH, we have something on our system called an accommodations care plan. And what this is, you see a sample of it here on your screen, it is fairly detailed information about things like how your child communicates. Are they verbal? Are they minimally verbal? Are they nonverbal? How they express themselves when they're in pain or when they're frustrated. What types of things in a hospital setting do they not like maybe Band-Aids or getting their vitals taken, how to communicate with them, what some of the challenging behaviors are. This is something that lives in a place in the chart that is visible to anybody who opens it. And so we use this all the time with our, the patients that we have out here at the Lurie Center. If we know that they're going to another clinic within MGH, they're going downtown because they have an EEG, or they're seeing an eye doctor, or whomever it is, we are putting this information out there, or they're getting, they're having a surgery or having a procedure, because this is information that's going to help that other provider offer optimal care, right? And so this is a great thing to think about and to add in, especially if you have a child where you anticipate medical appointments, or they have upcoming surgeries, or anything like that. This is going to give good information that you can provide as well, but it's going to be in the chart, and likely the provider will see it even before they've spoken with you as the parent. So we recommend this to families, and just want to let folks know that it's out there. All right, and then advocating for increased supports, taking data. So, it's hard to manage, this challenging and unsafe behavior at home, but it is so important to make sure we're keeping some sort of information about these incidents, these difficulties, because it can be helpful for a number of reasons. I will say that I'm a big advocate for making sure that the methods are realistic, right? So we're not asking you to take data on every little thing that happens and just sort of like as if you have nothing else to do to just be writing things down all day long. We're looking at what is the most significant behavior that we're concerned about. How do we track that and take information in a way that's realistic for you? And then how do we share that data, right? It's not just about having our own running log and information. That can be incredibly useful to clinicians or medical providers as they're helping to advise on treatments. It can be extremely helpful to the school team or the day program or the residential program team for them to understand this is what we're dealing with at home. And then it absolutely can be helpful for decision makers or funders, right? This could be the school district. This could be the Department of Developmental Services, again, depending on the age of your child. Data is helpful, right? That anecdotal evidence that you're sharing as a parent can be helpful too, but if you actually have numbers that you can share with any of these folks, that can be extremely powerful. So you can use the data to advocate for more services, maybe for in-home supports, for a personal care assistant, for getting DDS for if you have an adult over 22 child involved, getting them involved, maybe increasing hours of supports, maybe a placement change. There's all sorts of examples of this, how data can be helpful. I would also say, if you are advocating for your child, as much as you might like to pick up the phone and make that phone call, writing putting things in writing, saving email, saving documentation that helps you to keep a paper trail and will also then provide documentation when you're requesting more services or help. So I can't stress enough, write it down, keep it, save it, data, any emails that you're sending, keep all of that, ideally electronically, so you don't have binders and binders and binders of worth of information, but that can be so helpful when you're needing to advocate for services. All right, so a lot of those, those are sort of lots of examples of issues that can occur at home. And again, different things to think about, some of them in the short term and some of them in the longer term in terms of creating a behavior plan that can be helpful. We're going to talk now a little bit about the car and some common car safety concerns. So one of the biggest concerns in the car was really anything that's directed at the driver. Physical aggression to the driver, reaching to grab, kick, hit, etc. Extremely dangerous. You compromise the driver, you could get into a car accident. That's going to now be dangerous for everybody. Certainly self-injury in the car. If you have a child who injures themselves by hitting their head against a surface and now they're sitting in a car potentially again next to the window or with the seat right in front of them, they can go forward and bang their head, they can hit to the side. That's a specific car safety concern or a specific type of self-injury that's extra concerning in the car. Even screaming and yelling, this might be something that you can easily ignore at home. Those loud yelling, screaming, swearing types of behaviors. When you're in the car, it's a bit of a different ballgame. Now it becomes a distraction to the driver, right? So that's certainly a concern. Seatbelt removal, opening the car door or attempting to open the car door when you're not supposed to be opening it, grabbing at the steering wheel. Any attempts to break windows, with an object or by punching a window, throwing objects. This is certainly a concern in the car. And then, of course, bolting from the car. So these are all things that I would sort of consider to be common challenges. How do we think about car safety recommendations? So first of all, this might depend on the kind of car that you have, but making sure that your child sits furthest from the driver. I know many families who sort of say, all right, we're going with the minivan or we're going with the third row, right? Because in a car that has a third row or third bench or, minivan, et cetera, you can have an entire row of space between the driver and that individual, that child. Okay. And so that just eliminates any issues of actually being able to reach, to grab the steering wheel, And then we might need to be strategic about how we place other children, right? That's another factor. If you're one parent and you have more than one child, that becomes challenging to think about. Okay, I might be safe as the driver. Where do I put my other child? And this, again, largely depends on the kind of car that you're driving, but ideally furthest from the driver. Engaging the child locks, you see that in the picture there on the slide, that this is typically in the car door. Generally not a bad idea to have the child locks engaged if your child is prone to trying to open the door and run out before you've gotten out of the car. There are car seats, and there's also adaptive car seats for younger children. And I think this will come up later as well. I do want to make a mention here. Adaptive car seats and adaptive strollers, if you have younger children, something to look into that your insurance company might pay for. And there's a process around that. I'm not going to get into that today, but I do want to make that mention that that could be something that you get covered by your insurance. But certainly car seats can be helpful because they typically have a harness system that's a bit more secure. Devices that make it not possible to remove a seatbelt. So common ones are buckle bosses or buckle buddies. And recently had a conversation with a parent about, well, what about for a 5-point harness for a smaller child? Well, they do make similar types of buckle guards for car seats. Okay, so take a look at those. Basically what it is that there's a little tool that you put in to unlock the seatbelt, and the adult can do this, but the child cannot. So dangerous when a child is removing their seatbelt. This can be an easy device that works with children and adults to make it so they are not able to remove the seatbelt on their own. If you have a child who throws items, you have to be mindful of what you give them in the car, right? It's so helpful to have those fun items. If you jump down to the bottom of the list, right, allow activities that make the ride more enjoyable. You might have a smoother ride if they're listening to headphones, or if they're playing with a particular toy. But if that toy can then be a weapon that's thrown across the car and potentially can hit the driver, now it becomes a risk that we need to think about. Okay, that's going to hurt the driver. So what is something that is less likely to hurt the driver? A magazine would be better probably than a book, for example. So these are things that if there is a risk of throwing, we have to think about what we're putting in the hands of our child and what could then be risky later on during the drive. Again, unless supervision is available, you have somebody available to sit next to the child, then it's certainly easier to allow access to these items. And that, which brings me to this next point. We don't always have the second person available, right? I mean, that's just reality. Oftentimes you're one parent driving your one child or all of your children. But there are individuals where it gets to be the point where they absolutely do need to have a second person next to them, especially during longer car rides. And so this just becomes a consideration, and it can be extremely challenging because then it limits what you and your family are able to do. I will speak also to those of you who have children in transportation situations, either going to school or going to a program, same thing. Those situations usually have it's not just your child, and so you might need to advocate for that additional person, that aide, to be sitting next to your child to make sure that van ride or car ride is safe. But again, the more enjoyable you can make that car ride, the smoother it's going to be. Maybe you can't give them a device to listen to music, but you can put their favorite music on, on the radio, or, something that doesn't involve an actual item that can be thrown. But those are example car recommendations. And you see a couple of pictures here, adaptive car seats. That's the example of a buckle boss. And then seatbelt tags, just to give information, is another safety item that can be quite helpful. All right, we're going to shift into now community safety concerns. And before I start, you see a picture there, and since I'm not able to interact with you, I can't ask if anybody recognizes what that photo is from, but take a moment to look at it, and I will tell you that that photo is taken on a summer evening in the North End. And why do I have that photo? The reason I have that photo there is because if you have a child who doesn't like crowds, doesn't like noise, doesn't like waiting, for example, where are you not going to take them on a Saturday, beautiful summer evening? You're not going to take them to the North End because this is what it looks like. Okay. And so we're going to talk about how we think about, community integration and being safe and working for your child, right? What are some of the most common community safety concerns? Crowds, absolutely. And because crowds can be overstimulating. Noise, this could come from a crowd or could just come from all sorts of places, depending on what the activity or the outing is. Waiting, for those of you who have children who do not like to wait, we cannot generally not control that. There might be lines to get into favorite activities that can be challenging. Certainly just disruptive behavior in general. Dogs, you might have a child who's afraid of dogs or doesn't like dog barking. We can't really control when we bump into dogs outside. Certainly water, as we talked about a little bit earlier. Parking lots, this is a big one for sure, where we want to make sure that our child is safe walking through a parking lot and being near busy streets where there are cars. And if your child doesn't have any sort of safety awareness skills, that's going to be quite risky. I want to mention that behavior for your child, it might vary as far as what it looks like in the community versus what it looks like at home. And for some of you, the behavior of your child in the community might be fabulous, right? They might look like a totally different kid for a variety of reasons, because it's not the home setting. Maybe they're a little less comfortable. Maybe they're more excited. They like the activity more. But it also might be worse, right? Behavior in the community might be worse than it is at home. And depending on which one that is, you may need to make those modifications accordingly. So once again, here I am saying this now, and I said this from the beginning, we have to think proactively. We need to think about what are the activities that your child and you can handle, okay? And I say this because as a parent, you might feel as though you might feel an obligation to take your child to do certain things, or you might get pressure from your family, from your own parents. Well, no, we all must do this together. We're all going out and, celebrating this birthday, and your child must come, right? And the reality is that activity just might not work for your child. It might be too much, and it might be too much for you because of, again, the different things that we talked about that are less predictable in the community. So start with that, right? Be realistic about what your child can handle in the community, what you can manage, and also recognize that that changes over time. Okay, you might be at a place right now where your child's doing beautifully in the community and they're engaging and they're, having really successful outings. And then you might come upon a time where that's not the case. They're going through a harder time, maybe in all settings, maybe at home, maybe at school, and maybe in the community. And you might need to pull back a little bit, but that doesn't mean it's forever. It may just mean that you pause and then you, sort of figure things out in all settings. And when your child's feeling a little bit more comfortable and ready, then we enter into the community again. But the main point here is that it changes over time. It's a fluid process, and you want to be thinking about primarily the needs of your child and your needs, and not all of the pressures around you that might influence you to put yourself and your child in a situation that they're not ready to handle. So thinking about the best time to take your child to minimize disruption, I think is critical. Again, your child doesn't like lots of crowds and people and overstimulation, right? Don't go to the North End on a Saturday in the summer at nighttime. Go when it's a little bit rainy on a Wednesday, in the fall. You could still get that same great Italian food without all of the crowds and waiting and overstimulation, avoiding the long waits, right? So knowing, okay, my child likes the movies. When do we go? Well, we don't go in that popular movie first gets released, and we don't go on a Saturday afternoon, right? Thinking along those lines for any activity that you're wanting to do. The disability placard, some of you may know this, some of you may not, but with an autism diagnosis, you can certainly apply and be approved to get a disability placard. I've talked with families and, certainly have heard things like, well, I don't want to do that because my child can walk, right? It's not about the ability to walk. It doesn't necessarily have to do with anything physical. It's specifically about a couple of safety things that I want to mention. One is, again, if your child does not have safety awareness skills, and you park in a large parking lot, you then have to help them navigate it, potentially with other siblings as well. A big parking lot with cars coming in and out, that's dangerous. Whereas if you have a disability placard, you can park in that front spot, and you don't have to navigate the whole parking lot. You can walk right into the building. Additionally, from the safety perspective of, and I'm sort of getting to this, of you might need to make a quick exit. You go into an event, and again, your threshold in the community probably is a little bit lower than what it is at home in terms of tolerating that challenging behavior for a variety of reasons. So if you need to make a quick exit because your child's melting down, things are not going well, instead of having to walk 10 minutes to the car or again navigate a parking lot, if your car is right there, that's going to be a lot easier and a lot safer. So that's a consideration if you haven't already thought about that. Certainly staying in the loop about sensory friendly activities and adaptive programs. There's lots of these out there. They tend to have a much higher tolerance for disruptive behaviors, and it's just about knowing where to look and getting on mailing lists. And so I have some links to that at the end of the talk today, so in the resource section. Thinking about planning the bigger activities when you have more support. So if you're one-on-one and it's hard to manage your child, your adult, and they want to go to water country, for example, or you could plug anything into there. Maybe you don't do that by yourself, right? It's a long drive, it's busy, it's a tiring day. Maybe you make sure to do that when you have more people that can join that activity. As I mentioned, if you have that car, keep it nearby in case a quick exit is needed. And really, I can't stress this enough, intervening early. Do not wait until your child has cleared 17 shelves at the supermarket before you decide, I don't think this is working out, we should probably head to the car, right? Those early signs, and you know what they are for your child, of like, ooh, things are starting to not go well. That's when you might just leave your cart and make an exit while it's still safe to do so, while your child is still willing to make the exit, okay? You wait too long, it can cause a much bigger scene, more destruction, more difficulty, and make it more challenging for you being in public. Again, we can have a higher threshold for some of these challenging behaviors at home. Once we get into the community, we don't know how folks are going to react, and just the environment in general is less predictable and probably less safe. And so we want to intervene early to maybe take a break. It doesn't mean to end the activity. Maybe it's that we're intervening early to say, you know what, we're going to go back to the car for a moment, or we're going to sit on the bench for a few minutes until we're ready, and then we're going to go try again. It doesn't mean that you have to terminate the outing, but we don't want to sort of overlook it because things can escalate quickly, and then that situation can become quite unsafe. I want to talk for a moment about flying. Again, some of you might know this, but there's some fabulous programs out there. Here at our very own airport, we have Wings for Autism. What this is it's a program that offers a dress rehearsal day to practice the airport and flying experience before a trip. So you sort of practice the routine of going into the airport, getting the boarding passes, checking the bags, going through security, and getting on an airport. Getting on the aircraft. So this can be really helpful if many of you probably have heard of social stories. This is sort of like a social story, but in action. Like, we're practicing without actually taking off in the flight, so that way our child knows what to expect when we go on a plane. TSA Cares, Transportation Security Administration. Parents have said that this is also very, very helpful. So you can kind of look into seeing, how that group can be helpful to you. You might request a letter from a doctor before traveling that outlines accommodations, like, my child is unable to wait. Again, usually through TSA Cares, you can get these accommodations as well, but not a bad idea to have a letter with you in the event that you need it. And then I would always recommend, depending on where you're traveling, plan ahead, see what accommodations the airport offers. I was looking this up the other day and found out that Logan Airport has a calming sensory room in Terminal E. I didn't know that. And I don't know, what other airports have, but this is a good thing to do some research in advance when you are planning to fly. Certainly a big advocate for using visuals and practicing those routines, just like we talked about with the airplane, and practicing that routine can be helpful. Here are a few different examples of visuals. It might be just what the expectation is when I get in the car. When I get in the car, I get in my car seat, I put on my seatbelt. Like, boom, that's it. Just something that we're going to review, we're going to practice until it becomes part of the routine. Maybe there are playground rules. This is what the expectations are at the playground: waiting your turn, using nice words, gentle hands, right? These are good things to proactively review with your child when you go to a place where maybe that, they've had difficulty in the past. So remember, we're going to work on this, and then maybe there's a reminder, and remember, you're working on those playground rules, or we're going to have to take a break and sit for a few minutes, right? So it's good to establish what those rules are, or rules in the restaurant, and review that before we go out into the community. And then certainly safety signs, again, never too early to start learning about safety signs, things like don't touch or do not enter or stop. These are things your child's going to encounter, and at some point, maybe without your presence. And so having them understand what those signs mean can be quite helpful as well. And there's so many different visuals out there. I just wanted to give a sample of a few of them. In terms of community integration, I think that community integration is extremely important. Absolutely. And I also think that it is important for that community integration to be safe and successful. That goal, I think, cuts across all ages, for sure. And that in order to do that, we need to think about careful preparation, right? And this might be that we have a plan A, we have a plan B, we have a plan C, and a plan D, right? Because remember that the community is unpredictable. It's okay to start small and to build up, right? You might have a goal that your child is able to go to the Museum of Science because you want to take them to a 4D show that you think they'd really like, right? But the Museum of Science, there's a lot of steps that are part of that routine. Getting into that massive parking lot, going from the parking lot, walking down a really long hallway, getting the ticket, et cetera, et cetera, et cetera. And so maybe the first time we're just going into the parking lot, or we're going into the parking lot and we're just going into the waiting area and we're not actually buying tickets yet, right? And you can sort of build up over time. Or maybe we're just looking at going in for 10 minutes, which isn't normally how we think about that type of an outing. But again, we don't have to pay the entrance fee and stay for a couple of hours. We could go there are actually some things that you can interact with in the lobby area that you don't have to pay for, or maybe the gift shop area, whatever it might be. But you start small and build up. And there's no rules around this that say, well, you have to go into a movie and see the whole movie. Your goal is to see a movie. Maybe you just go in first and you get the popcorn and you leave. And I really like that popcorn. All right, let's go sit in a theater. And by the way, let's do this at a time where there are not a lot of people, and it's not going to be overstimulating. But again, as I said earlier, remember that there are times when challenges increase, and it's okay to decrease community integration. I get this question all the time because there's a lot of guilt around it, like, but I don't want to stop swim lessons, or I don't want to, but it's been really difficult. It's okay to pause and figure things out and then restart, okay? Or to back up a little bit. Like, we might have come so far, and worked so hard to be able to go to the full movie, and then we're not there yet. It's okay. We'll go watch the trailers, and then we'll try again. We'll build back up. I just put in this example because, again, folks have asked me about these. There's all different ones out there. Some people do like to have a card or a letter to hand to another person in the event that there is some sort of an incident or challenge or difficulty. Again, this is personal. You might be of the mindset of it's none of anybody's business and I don't care what anybody thinks. On the flip side, you might say, you know what, I want to educate or I want them to know what's happening and that's important to you. And you might have something like this that you share with somebody. I don't, I think that's a personal decision, but I want everybody to know that these do exist, or you can certainly create your own if you feel like that would make you, that would help you to feel more comfortable out in the community when there's a difficulty. All right, I know we're almost out of time and I want to take some time for questions. So just quickly, and feel free to take, pictures of these slides as we're going through. Autism resources for family. Autism Speaks has fabulous toolkits on their website that are free for families. And there's some on safety, they're on all different things. I recommend you take a look at those if you haven't already. Here are examples of sensory-friendly event and activity places to find these. Autism support centers, SPED Child and Teen, spedchildmass.com, Autism Alliance. 3 places you can start looking to get on those lists of those different places. How to find an ABA provider. This again, take a picture of this because for those of you who would benefit from in-home ABA, these are some really good resources to go through to help you get that information. Certainly the Lurie Center, we're always offering different events and trainings and various things. So you can subscribe to our news and announcements. And you can also follow us on Facebook. And then we offer other courses, the Behavior Basics class. And I think there was a question in the chat of, is this just for children or adults? It's for people of all ages. But our Behavior Basics class is focused on developing a behavior plan in the home. Parent CPI, this is focused on de-escalating challenging behavior. And it includes a physical intervention. So intervening physically, that's a 4-course series. And we've just added monthly drop-in Ask a Behaviorist groups. If you just wanted to sort of come in and ask for some help, and you can call the Lurie front desk or email to register. All right, I'm sorry, we have a couple more minutes for questions. Amy, did we have any questions that I didn't cover there?
Thank you, Nicole. We do have a question regarding any tips on how to handle biting and protecting others from the biter, particularly when the person prone to biting is a large adult.
Yeah, so I have lots of tips on biting. The class that would be most helpful for that would be the Parent CPI de-escalating challenging behavior class. But what I would say is with biting, body positioning is what is the most important because the biting comes from one place. So if we know that we're with an individual who bites, we need to think about where we're positioning our bodies, our hands, right? Not putting them in front of their mouths, and where we're positioning ourselves to minimize their access to us. In the event that they do, in fact, actually bite, there are techniques, and this is part of that training that I mentioned, that you can help to release that bite more easily and more safely. They're not the most intuitive. You generally want to, feed and lean into the bite as opposed to pulling your arm away. But honestly, when I think about biting, the most helpful thing I could say is we have to think about where we are, and generally to the side and behind, and not putting arms and things in front of their mouths is my #1 piece of advice.
Thank you. And I had entered our Blum Center email address in the chat, pflc@partners.org. For anyone interested in the list of resources shared in today's presentation, feel free to email us and be happy to share that with you. I also entered in the chat a PDF, and I believe for the PDF, it's only viewable for those who are tuning in today on a desktop computer. If you're joining today through a mobile device, you might not be able to see this PDF. It's a PDF with a list of safety resources for individuals with autism. If you're interested in also this document, feel free to email us at pflc@partners.org and be happy to share that with you.
Thank you so much, Amy. Thank you all for joining.
Thank you. Before we end today's session, do you have any final thoughts you'd like to share with the audience today, Nicole?
I would just like to say that I think there's a lot of supports and resources out there. Reach out to the Lurie Center, stay connected to us. We're offering tips all the time. Reach out to me. Always happy to, offer resources as well. And stay safe.
Thank you, Nicole.
Thank you.
I did want to mention one final thing. I included the link to our Blum Center website address. So if anyone is interested in viewing the recording of today's session, want to share with others, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you, everyone. Take care.